Hello, and thank you for joining us for the 23rd Annual Virtual Elder Abuse Conference, Serving Older Adults During Times of Isolation. This conference is presented by the Syracuse Area Domestic and Sexual Violence Coalition's Elder Justice Committee. My name is Lori DiCaprio-Lee, and I am the ID Theft and Outreach Coordinator at Vera House. Before we begin today's presentation, I'd like to acknowledge some recent events. The COVID-19 pandemic has highlighted issues of inequality. Older adults, those who live in poverty, and members of Black and Brown communities have been more severely impacted. The Elder Justice Committee values all older adults and stands in solidarity with the Black community. We pledge to uplift the voices of Black people in our community and strive to fight the injustices that have led us to this moment. Thank you. So all webinars during this conference are free thanks to the generous support of our sponsors. And we were very fortunate this year to have two platinum sponsors, Loretto and the Onondaga County Department of Adult and Long-Term Care Services. So today we have representatives from each of those sponsors to share a few words. So first, I'd like to introduce Brenda Mccutcheon. She is the Vice President of Mission at Loretto, and she has a recorded message.
On behalf of the Loretto Family of Care, thank you for your attendance at this Elder Abuse Conference 2020. Thank you for the opportunity to speak to you. This year we meet in a changing world with the coronavirus greatly impacting daily life and how we go about our day-to-day business and living. This year I am marking my 28th year in elder care, and it has been one of the greatest privileges in my life. I thank Vera House for this conference. In person or virtual, it is a gift to the Syracuse community because it creates needed networking, it increases awareness, but for me, it offers us hope. Hope that can be hard to experience when you think of some of the pain, hurt, and abuse that older adults experience at the hands of others. But we always have hope. So let's imagine a world where voices and choices are honored. The past months have been filled with change for all of us. But that is the one thing we want as we gather here today, change. Where elders have a voice, where they are safe, where their wisdom is respected, where they can be free of isolation and loneliness and abuse. That is a hope that is still very alive in me, and I am sure it is in all of you too, because the quality of life for our elders matters. The blessing today is when we gather, whether physically or virtually, we create energy. We create unity of purpose. We create and explore possibilities in new ways to mitigate elder abuse in our community. But it does start with each one of us. It starts with keeping our elders engaged in a community. It starts with designing resources. It starts with noticing changes in them and speaking up, and caring for the caregivers, and being bold and brave and courageous and doing what is right. In the very beginning of the coronavirus pandemic, I found a poem. I hope you don't mind me taking a minute to share it. It's called Ask Me Anything by Samantha Reynolds. I am not old. I am not old, she said. I am rare. I am the standing ovation at the end of the play. I am the retrospective of my life as an art. I am the hours connected like dots into good sense. I am the fullness of existing. You think that I am waiting to die, but I'm actually waiting to be found. I am a treasure. I am a map. And these wrinkles are imprints of my journey. Go ahead. Ask me anything. Elders deserve the right to have a voice, to be seen as a treasure, to be seen as a map. Thank you for being here today. Thank you for wanting to know more. Thank you for supporting our elders in this community by advocating for them and being part of this conference that empowers us to be part of the solution. God bless all of you. On behalf of the family of care, thank you for your attendance at this Elder Abuse Conference 2020.
Next, I would like to introduce Joanne Spoto-Decker, the Executive Director and Deputy Commissioner at the Onondaga County Department of Adult and Long-Term Care Services. Joanne?
Thank you, Lori, and good afternoon. I'm so proud to represent the Onondaga County Department of Adult and Long-Term Care Services at this very special Elder Abuse Conference. We have been involved since the very beginning, either as a presenter, sharing our resources at an outreach table, and most recently as a major sponsor. Why? Because our department works very closely with Vera House on the issues of elder abuse and financial exploitation. Our department serves seniors and vulnerable adults, and we work together to keep them safe from harm. Some examples of that would be our participation in the Vera House EMDT committee, where we come together regularly with law enforcement and the court system to help prosecute financial exploitation of seniors, and as you know, is often perpetrated by family, friends, and caregivers. Several of our staff fully participate in various committees through Vera House that align with our mission and goals. Those include the Financial Exploitation Committee and the Elder Abuse Justice Committee. We participate because we know firsthand the needs of older adults who are in abusive relationships, especially when they are unwilling or unable to talk about it. The Onondaga County Department of Adult and Long-Term Care Services consists of 5 units: the Office for Aging, New York Canucks, Adult Protective Services, Mental Health for Adults, and the Long-Term Care Resource Center. When county residents and caregivers contact our department, they are served by staff that meet their needs, whether it is meals or transportation through the Office for Aging, an assessment of long-term care needs from New York Canucks, or an assessment from our Adult Protective Unit, mental health resources and assistance in our community, or personal care services from our Long-Term Care Resource Center. We all share a common thread. That is, we work collaboratively to meet our mission, which is working together to promote social equity and service delivery while meeting the scholarship of diversity. In these times of uncertainty, one thing is certain. We will never stop working to prevent elder abuse in our community, and we will always stand with Vera House. We're proud once again this year to be a sponsor, and we hope to continue to do that so in the years to come. Thank you very much.
Thank you, Joanne, for that. I want to take a moment to also thank our gold sponsors, Syracuse Jewish Family Service and Wegmans, and our silver sponsors, the Alzheimer's Association of CNY, At Home Independent Living, Community Bank, Countryside Federal Credit Union, Krause Health, Fulton Savings Bank, Syracuse University School of Social Work, and Touching Hearts at Home. More information about all of our sponsors can be found on the Vera House website. The support of these sponsors not only funds this webinar, but also extends beyond the conference to continue elder abuse education and prevention outreach after the event. So today's webinar, which is the last of our virtual Elder Abuse Conference series, is a facilitated dialogue that brings together many of our speakers from the previous presentations for a roundtable discussion to answer your questions. While the chat feature is disabled, you can use the Q&A feature to ask your questions, which is going to be monitored by Jill Rutledge of Vera House and myself. So I want to begin by introducing the speakers that are with us today by their name, their title, their webinar title, and then ask them this question. Identify one way the COVID-19 pandemic has affected your way of providing services. So we will start with Hazel Heckers. She is the Victims Assistance Coordinator at the Colorado Bureau of Investigation, and her webinar title was Pandemics and Predators. So welcome, Hazel.
Thank you, and thank you all for having me. It's very exciting for me to be a part of this process, and being out in the West in Colorado, I feel really honored to be included in your state's stuff. So thank you, Lori. I really appreciate that. So as an employee of a first responder agency, much of the things that have affected other agencies have not changed in the way that we do business. We still respond in person, we are still seeing people face to face. But because of the overall pandemic issues, it has changed some things in the way that we do business, and just trying to think of one is really hard, but I think it all comes down to just the isolation of the people who we serve. And that because our state is, we serve the entire state, and our state is quite large, and only very small portions of it are heavily populated. A lot of our state is still quite rural and remote, including several Indian nations that are in fairly remote regions. And so that level of isolation for older adults in those communities has increased tremendously. All of those resources that we've always depended on, like senior centers, churches, the Grange, other kinds of resources have all kind of dried up and been unavailable. And because many of those people don't have computers, and even if they did, internet service to those remote areas is sparse at best, if it exists at all, it leaves them out also of the whole web-based process. So what that has meant for us is that we've had to take on some roles that we don't normally take on, and have had to increase some things that we normally do. One of those things is an increased number of welfare checks, where our officers will be going out with staff like victim advocates and caseworkers to do well-being checks on people that we normally would not have needed to do, because they would be coming to congregate meal sites, they would be coming to the senior center, they would be coming to events at the Grange or at their local church. And those are very labor-intensive events. We've also seen an increase in the number of call-outs for our critical incident teams, because there are more people in need of that combination of law enforcement and mental health services. So we've seen that increase. And then we have had to become experts, those of us who answer phones, dispatch centers, hotlines, victim advocates. We've had to become experts in things that we are not experts in. We've had to become experts in health issues. We've had to know what the CDC and the WHO are saying. We have to know what the governor says. All things that are about health and safety, where normally our focus is on physical safety and safety from crime, not on health-related issues. So we've had to become experts in that. We've had to become experts in what the IRS is doing with stimulus checks, so that we can explain that to people. So it's really been creative for us. We've also had to really increase our ability to listen. It's amazing to me how much face masks interfere with our ability to do our job. We are so accustomed to reading people's faces and expressions, and having that body language be a part of the story for us. And not having the access to that has had to make us learn new skills and new ways. But it's also kind of further isolating those older adults who maybe have gotten so accustomed to reading lips, because their hearing is going, and they need to read lips and facial expressions. And so to ask us as officers, please remove your face mask, is embarrassing. So we've had to learn the skill of saying, would it help you if we removed our face mask while we talk? So, you know, it's changed the way that we do things. I think some of it's been difficult around the isolation, but some of it has made us better at our job. So thank you.
Thank you for sharing that. So next I would like to introduce Jenny Ackley. She is the director of the Abuse in Later Life program here at Vera House. And her webinar title was Elder Abuse 101, a social justice issue and the COVID-19 impact. So Jenny will ask you the same question. Identify one way the COVID-19 pandemic has affected your way of providing services.
Thank you, Lori. Can I say Zoom? I think what I've learned, a lot of the work that I do at Vera House is community-wide collaboration and working with all these wonderful people on this screen, as well as many, many more in this community. What I have found is how important technology has become in doing this work, and how it's also a barrier for many people who do not have access. So as this pandemic continues, I foresee that this kind of work will be continuing. I don't think it's going to stop real soon. Just as things start to look better in some places, they start getting worse other places. And I do think there will probably be an ebb and a flow to this work. But what I'm hopeful of is that we are finding ways to do this work together, and finding platforms to do the work together. So even this conference, honestly, if I look at Lori and know a few months ago we were going to have this conference live, and somehow we were able to pull off, thank you, Lori, a conference with a lot of amazing workshops, thanks to all of the people on the screen and the people who helped plan it and our sponsors. And I think this kind of has shown how we can be flexible and be able to respond to some of the issues. So I guess number one, that we do have access to technology and can have lots of meetings and collaboration through this vehicle, but also understanding that this is also a new barrier for a lot of people. So it's kind of the both. Thank you, Lori.
Thank you for that. Next, I want to introduce our first panel. We had Jennifer Cordino, she's the Elder Advocate and Trainer at Vera House. We had Lori Klevak, the Director of Senior Services at Interfaith Works of CNY. And we had Cynthia Carey Woods, the Executive Director at Upstate Oasis. And their webinar title was Connecting and Caring in the Community with and Without Technology. So Jenny C., let's take you first. Identify one way the COVID-19 pandemic has affected your way of providing services.
Okay, so I think that it's important to address that I am the elder advocate at Vera House. That being said, my clientele is anybody who is 50 or older who's looking for advocacy is assigned to me. And certainly the COVID-19 impact has been tremendous. We've seen a lot of mental health issues coming to the forefront of our conversations. But it's also increased our need to be really creative. And I say creative, particularly with our safety planning, because a lot of individuals are stuck at home with the person who's abusing them. So it might not be as easy to jump on the phone or to jump on Zoom when we have transitioned our support group to a Zoom platform. This was also another hurdle where we had to teach some of our older adults how to use Zoom. And it wasn't possible for everybody, but for those who were able to participate in our support group still, to be able to connect with others and certainly overcome and address some of that social isolation that has, I guess, come to the forefront. We have nicknamed our support group as a book club, and that is our key safety word. So I think that that's a really interesting creative piece that we have adopted. And this was prompted actually by the members of the group to say that if their abuser had come anywhere near them or at the facility where they're having this conversation, all they have to do is say something about the book that we're reading, and everybody would know to stop our conversation, allow them to become part of, again, the book club, and then to sign off for safety purposes, which would then prompt me to make a follow-up call later on to check in. How are you doing? Are you safe? But yeah, so definitely the safety piece has needed to be very unique. And we have been able to adopt that through all practices, including our support group. So thank you.
Thank you. That's great. Lori Klevak, same question. Identify one way the COVID-19 pandemic has affected your way of providing services.
Yeah, well, our programming really focuses on providing opportunities for socialization and engagement to break cycles of isolation that people experience as they age. And so all of our in-person activities, friendly visits, companionship, social activities, English classes, like everything had to stop. So we're all, it's a common theme. We're learning how to transition, how to meet our clients and our participants where they are with technology and help them move to the next step. If they're comfortable with the phone, we make friendly calls and well checks. If they're already using their smartphone, maybe we can support them to do Zoom or to join, you know, an activity online that they wouldn't have before. So a lot of barriers, but also a lot of opportunities for creativity. We've seen a lot more volunteers step forward for some of our programming and to do friendly calls. And so that's been really exciting as well. But we've had to stop all of our in-person visits, which has been really hard. And so now at the point where we're figuring out how might we bring people safely back together, because you can't just leave people isolated at home or in nursing homes indefinitely. So we're at the point where we're figuring out what's next.
Thank you. So Cindy, your turn. Identify one way the COVID-19 pandemic has affected your way of providing services.
So the Upstate Oasis program is a lifelong learning program sponsored locally by Upstate. And the goal of the program is to keep folks over 50 active, engaged, and aging well. So we offer these lifelong learning classes, again, like everyone else, in person traditionally. We offer opportunities for volunteerism, both here at the site and off-site. And then we also offer opportunities for seniors to volunteer to tutor. So we have an intergenerational tutoring program for grades K through 3. All of that requires that in-person piece. And like everyone else, we've had to pivot quickly to Zoom. We have a couple options here at Upstate to use online platforms, but Zoom seems to be the most user-friendly for most people. So in a very short amount of time, we had to educate all the staff, all our instructors, and juggle programming that was suitable for this platform to an online format. And then we had to offer some free classes so that we could get folks at least familiar with how to engage from the user end and have people comfortable enough with how to do exactly what we're doing right now. I feel like in a lot of ways, not only are we proficient at it at this point, we're almost too good at it, and who knows how long this will go on. But that was, I think, our biggest thing, just making sure everyone could really access this. But there were some, and I think it's really worth noting, that in having this technology piece that we all are using right now, there is a really large divide in our area locally with the folks that have technology and the folks that don't. And so we needed to come up with some creative opportunities for folks to engage those that are isolated with, their phones or other means if they don't have access to a laptop or a desktop or an iPad, some other way to connect using a Zoom platform. So, we work together with our national Oasis, and there's some phone programs that were established because of this COVID-19 epidemic. And so we're using those to kind of reach out to the folks that can't actually engage in this way. So it goes back to just trying to keep people engaged in ways that they aren't feeling isolated, and that we can work together with these partners to create programming that helps everyone feel connected and safe.
Thank you for that. So our next presenter was Stacy Plichta. She is a professor and and doctoral program director at the CUNY Graduate School of Public Health and Health Policy. And her webinar was titled Self-Care and Wellness for Frontline Workers with the Elderly. So Stacy, the same question to you. Identify one way the COVID-19 pandemic has affected your way of providing services. So unmute, gotta unmute yourself.
Okay, is this better?
Thank you, thank you.
Okay, so I think Zoom, like everyone else, but the challenge for me, you know, I'm an educator. I also do trainings for New York City. CUNY is one of the places training the resource navigators and the resource navigator supervisors. And one of the things I know as an educator is people don't learn when I'm talking. They learn when they're talking. They learn when they're engaged in something interactive that's applying the knowledge that I'm trying to impart. And on Zoom, it's much harder. So, you know, in a classroom and it's live, you know, teaching at its best is a kind of theater. So you put yourself out there. It's harder to push energy through a screen and then to draw it back from the group to keep the interactivity going. The other thing that, and I want to talk about this because I think it might be useful for some of you all, is how do you do celebrations? You know, especially now, it's important to celebrate successes. And we had 14 doctoral students graduate. Getting any degree is a big deal and a lot of work. But these students had been with us anywhere from 5 to 10 years, you know, working on their degrees. And so the challenge is, how do we celebrate? We couldn't do it in person. And, you know, to do something, just on Zoom, there were too many, because 14 parents and significant others, and you get, it's too many to really be interactive with. So I actually mailed out packages to everyone. I spent some time at the dollar store and mailed out like little graduation packages that had, and just little some confetti, congratulations graduate, these, it didn't really matter what it was. Some things that, and then, one of the things I sent was an instant cocktail. There are these tablets and they're not alcoholic unless you add alcohol. There are these tablets you just drop in soda water and they make margaritas or they make cojitos. So I sent everybody a glass so that we could raise a glass together and a, and a tablet. And so what we did was, at least by sending them something, I was able to have everyone raise a glass at once, and we spent a little while talking about each person. But I think that's been the biggest challenge, is having to think about ways that to keep Zoom two-way and to celebrate effectively. Otherwise, it's just all doom and gloom, and that's not good for anybody's mental health.
Thank you for that. I wanted you to know that every now and again your mic would cut out a little bit, so just so you know, but we heard you. Thank you. Our next presenter was Karen Morrow. There you are, Karen. She is an ORS counselor at Crouse Health, and her webinar title was Substance Use and Social Isolation in the Older Adult During a Pandemic, How Can We Help? So Karen, same question for you. One way the COVID-19 pandemic has affected your way of providing services.
Thanks, everyone. So you want me to give you one way? It pretty much affected every way. Yeah. We had, prior to COVID-19, we had, just a really active center here with 47 groups on site. All the counselors did on-site individual counseling in groups. And then when COVID happened, we clearly learned that we were going to have to change that. Initially, we went to 6 feet apart, groups, and broken up into 2, maybe 8 people per group. And then OASIS came out with the recommendation that we needed to move to telehealth. And honestly, most of our counselors did not have any experience with telehealth. So we had to learn really quickly how to do telehealth counseling, learn the ethics behind it and the proper protocol very, very quickly. So the first week in April, we were doing almost all telehealth groups. It was not easy. It was quite stressful, but on the other flip side of it, our patients were giving us the feedback that they were so happy that we were still there for them. that we were still connected. So that kind of fueled your motivation to keep going.
Great, thank you. Michael Close, social worker at the Syracuse Veterans Affairs Medical Center, and his webinar title, VA Social Workers Serving Elderly Veterans During a Time of Crisis. So the same question for you. Identify one way the COVID-19 pandemic has affected your way of providing services.
So I think it's a little early right now for any specific data about whether we were successful or we needed to improve on certain things. But the one, I did notice a couple things. One, I thought it was amazing how quickly the VA was able to have pretty much all the business aspect of the hospital was off-site. They worked from home. So they got IT support, they got phones, and they were able to, within days, they were working. And that was pretty incredible considering I work in the hospital and can't get IT support. And then I specifically work on the nursing home. So we have 42 beds, I think, a 42-bed nursing home program. And this is just like a microcosm of how we were successful, but we haven't had a single case of COVID in a nursing home of 42 where they're all chronically ill. They're all, we got a couple outliers, but for the majority of people, they're all elderly folks. We had to shut down visitors. The patients were no longer allowed to leave the floor, even to go to the store, little things like that. But that's just a small little part of how we were able to adapt very quickly and keep the virus out of the nursing home.
Thank you. So then we had another panel, and we have two members of that panel with us today. Jordan Aiello, she's an assistant district attorney at the Onondaga County DA's office, and Morgan Thurston, assistant welfare attorney at the Onondaga County Department of Law. And that webinar title was Court Challenges During COVID-19. So Jordan, starting with you, you're at the DA's office. So how has the COVID-19 pandemic affected your way of providing services?
Thank you, Lori. Obviously, the lack of in-person meetings has had a tremendous impact. The ability to have grand juries come together and juries come together has had a huge legal impact in that it's basically stalled most cases at a certain point. So we're waiting to get those things back up and running, and then we're going to have to deal with, the backlog that exists at that point. But in a more day-to-day sense for me, the inability to meet with my victims in person has been tremendous. It makes it extremely difficult for me to build a rapport with somebody, to assess their credibility, and to try to talk to them and have them trust me so that we can try to figure out how to move forward with all of these criminal cases. And it's also been extremely difficult to try to get people services, either defendants or victims, when that seems to be the right thing to do in a case. So it's made a lot of it very difficult, but that would be the biggest thing for me, is being able to meet with my victims in person. And I've gotten to do that a little bit more now under very stringent circumstances, but still not back to normal.
Thank you for sharing. And so then Morgan, you're up. Same question. How has COVID-19 affected your ability to, your way of providing services?
So personally, as the attorney for Adult Protective, one of the big changes was determining what was an emergency type proceeding that I could actually bring, because the courts were not allowing anything other than essential proceedings to be filed. And that certainly created a roadblock. Things have changed that, and I think maybe we'll get to talk about the immediate changes coming up now and later on in this process. Zoom, everyone has said. For court processes, it's Skype. and that's what New York State courts have settled on for their medium, and that's presented some different challenges on how we get onto procedures or onto court proceedings. And for me, like Jordan said, the personal interaction, I interact with caseworkers. I have to notarize their statements. I have to get information from them, and working remotely has definitely changed that for us too.
Thank you for sharing that. And then our final presentation was a joint presentation with Joanne Spoto-Decker, and she's here with us, Executive Director and Deputy Commission at the Onondaga County Department of Adult and Long-Term Care Services, and she presented with Natalie Roan from APS, and their webinar was Adult and Aging Services During the COVID-19 Pandemic. So Joanne, the same question for you. Identify one way the COVID-19 pandemic has affected your way of providing services.
I can speak mainly from the Office for Aging, and as many of you know, the county executive set up a senior nutrition hotline. And that was, I think, right around March 15th or 16th when we started. First day we opened, we had 178 referrals from people who were needing food and other things. They needed toilet paper, they needed hand sanitizer, they needed cleaning supplies. All of that was, at least initially, pretty overwhelming. And what we were finding too, I think the biggest thing is that a lot of people contacting the senior nutrition hotline were under what we traditionally think that people are senior. The Older Americans Act says 60 and older. So about 18% of the people that were calling our hotline and still are under the age of 60. So that was a big change for us. How we were going to deliver those services, how we were going to do it quickly, how were we going to set up systems to meet immediate needs. Luckily, we were able to tap into the resources of other county departments, as well as a lot of community-based organizations. So we set up a system to be able to deliver food and other supplies in a timely manner so people can get what they needed. I think the biggest response, or the biggest surprise to me, Lori, was the enormous response that we got. It really was an indication of the need in our community and how our county was very proactive in meeting that need. So it was a big change. It was, we had a few staff here in the Office for Aging that were responding to the Senior Nutrition Hotline, but we also had a lot of other support from other organizations. So it was a wonderful feeling to be able to come together, to collaborate, and to get the services that people needed. When I did our presentation for last week, I said that we had 2,901 callers to the Senior Nutrition Hotline for food, emergency food, and other services. That number's increased just a little, so that tells me that the systems are in place and that the needs are being met. But I think what I've learned mostly is that we can respond. We can respond to people that we don't normally serve. We can respond in emergency situations. We can respond if we all work collectively. So I'm very grateful to everybody that was part of that. And so if and when this ever happens again, I know that we'll be able to, to look back and say, this is what we need to do to get people fed and meet their basic needs. So thank you.
So thank you for that. So to our participants who are watching this webinar, now is your chance. We're opening it up to you, and you can ask your questions. And Jill and I will be looking at the Q&A, and we will be asking our panelists. So if anyone has something they want to submit, now is your chance. And there isn't nothing yet. So I'm going to, Morgan, where did you go? I'm going to ask, since you alluded to it, and I think it's good for everyone to know, things in the court system change, it seems like almost daily. And I know we had some recent changes even, I think, today or yesterday. So if Morgan or Jordan, maybe one of you want to share with us some of those more recent changes.
I can talk about the ones that affect me quickly, and then maybe Morgan can talk about his side. So we just got notice about like the phase 4 changes for courts, which means that the county court judges are now going to have 2 calendars a day instead of the 1 that we've been limited to for a while now. In normal times, it's 4, and there's as many defendants on them as you want. Right now, it's going to be 2, and it's 30-minute time slots per defendant so that there's not multiple people in the courtroom at one time. Town and village courts are finally going to reopen. So they are going to hear their own hearings and be able to schedule cases. I'm sure it's going to be very limited as to the numbers and how exactly they can do that. But until now, they've pretty much been unable to do anything with very limited exceptions, which has put a burden on other courts because the other judges have had to do it for them because they haven't been allowed really in the courtroom. But the biggest thing is that we've been told that on July 22nd, we are going to be able to impanel a grand jury. So that's going to be the first grand jury that we've had since early March, so we can start moving some cases forward. In normal times, we operate with 2 grand juries at a time. We've only gotten approval for 1, and the hopes was that we were going to get approval for 3 so that we could try to deal with the giant backlog that we have. So if we have 1 grand jury, they're probably going to be pretty heavily burdened and they're going to be working a lot as we try to get through. I think we have about 150 cases right now that we're backlogged and looking to indict. So we're just trying to figure out like how we can prioritize that and how the judges are going to deal with the fact that someone has a right maybe to be indicted within 5 days of arrest, but that's still not going to be feasible when we have 1 grand jury that's dealing with a whole lot of backlog. So there's still a lot left in flux, but at least we're gonna get a grand jury, so it's starting again.
And you want me to touch on, for my side, on the civil side, guardianships, both in Supreme Court and in Surrogates Court, effective July 1st, those are going to be heard in person again. For guardianships, evidentiary hearings and inquests, those are going back to in-person hearings starting tomorrow. The same with Surrogates Court evidentiary hearings. So big change for us. And it was a real difficulty for me as far as trying to get, for guardianship proceedings, to get the alleged incapacitated person access to appear remotely or getting them into meet with their attorneys. So this is a big change for us. So that's starting July 1st.
Lori, we do have a question if we want to start with a question.
Yeah.
We have a question, I don't know, it might be for Joanne or possibly Cynthia, or if anyone else wants to answer this, but the question is, as we have started to reopen and families that have been caring for their elderly family members are now returning to work, are there any thoughts on how to handle the extensive need for possible in-home care and or persons who will be further isolated?
Joanne, you want to take that one on? Joanne?
Yeah.
I'm not sure if you heard that question.
No.
Okay, I'm going to read it again.
Okay.
Because I think this might be a good one for you to think about answering. As we have started to reopen and families that have been caring for their elderly family members are now returning to work, are there any thoughts on how to handle the extensive need for possible in-home care and or persons whom will be further isolated?
Let me start with the first part of that, and people returning to work. We have social adult day programs in the county that some are operational right now. And so we are able to make referrals to those particular organizations who have opened. We also have an in-home respite program for people who are, so caregivers can get that break. It may not necessarily be for people who are working, but for caregivers who need a break. So we're, like everybody else, Lori, are trying to figure out ways to deliver our services, our adult day services, our respite in a safe manner. We also have an opportunity to promote consumer-directed programs through the Long-Term Care Resource Center and through the Office for Aging, so people can hire their own aides. So they may be able to hire their daughter, their son, someone who they're not fiscally responsible for, and someone who they have contact with on a regular basis to help out when a caregiver needs to return back to work. The other part of your question, if you could say that again, I'm also part of this technology where we talk on Zoom, but I'm not able necessarily to hear every single word. So I just want to put that out there for people. So if you can repeat that last part of the question, that'd be great. Nope, that's not working.
That was my fault. I didn't unmute.
Okay.
I didn't unmute myself.
Okay.
So the second part was, any thoughts on how to handle the extensive need for possible in-home care for the persons who might be further isolated? So the first part was, yes, about the caregivers, and then the second part seems to be about the older adults themselves who need the care.
I think that we do have a program for persons who are isolated and in need of aging services and who may need mental health counseling. That's called the SHARP project. And that project right now, we work with Helio and Liberty Resources. And we're providing, like one of your presenters said, we're providing telehealth services in a manner that we haven't before for counseling. So we have an opportunity to utilize that program to go into people's homes, and once we're able to, and provide face-to-face services. Right now, we're really kind of at a standstill because the New York State Office for Aging and New York State Department of Health, those are our two purview agencies, are not allowing us to have that face-to-face interview, face-to-face discussion, face-to-face reassurance with many of our clients. We are expecting that will be lifted sometime this summer. Hopefully there will. We already provide that, Lori. We go into people's homes. We are, through our expanded in-home services for the elderly program, our ISIP program, Newark Connects goes into home. Obviously, Adult Protective goes into homes. Long-Term Care Resource Center goes into homes. Our nutrition case assessor, all of these people have that face-to-face contact to help reduce isolation. One of the things I will say about that is not related to caregivers going back to work, but about reopening, is that we're now working with area senior centers and our senior dining sites, and our senior nutrition project director is working with them on a safety plan to reopen. That doesn't necessarily mean that they'll be able to go in for in-person dining, but they will be able to go to a senior center and drive through, get takeout, and maybe make some other connections with people they haven't seen before in a safe manner. So those are the things we're doing right now. We miss the fact that we can't go into the homes. We know that there are caregivers out there who need respite. We know there are people who need to go back to work, but because of the regulations and the guidance that we're receiving from our two purview agencies, it's difficult. So we're always giving it thought.
I recall Natalie saying that they had to adjust how their requirements to go out and visit clients hadn't gone away, but the way they did it, like standing on the front lawn, visually seeing them, making a phone call.
Right.
So the services were still there. They just had to adjust how they were delivered.
I think in Adult Protective Services, that certainly was with their purview agency had required they continue visits. What we've been doing in the Office for Aging, particularly in our expanded in-home services for the elder, ISIP program, if someone needs to have an application made out for SNAP or their Medicaid research redone, or whatever needs to happen, we're still able to do that, but we don't do it face-to-face. We may do it, we go over to the home, we have all the proper PPE on, we pick up the application, and we deliver it to where it needs to go. But like Adult Protective Services, we miss that face-to-face. Some of the aides, some of the older adults that we serve won't let their aides in the home during this time, so we have that option as well. So they're afraid to let people in. They don't want anybody in the house. So there's all kinds of things going on with all of the services that we provide. But yes, Adult Protective Services is doing a great job of making sure that they keep their clients safe. So we, on the other hand, our appropriate agencies are restricting us from doing that. But we're finding ways to, when people need us, to get the services that they need to get it done. Whether or not it's picking up an application from a stoop or handing it from from the home, or delivering meals, in a way that that is safe and secure. So we're finding those ways.
Thank you.
Yeah, Lori, if I just on the adult protective side, the state Office of Children and Family Services did put out guidelines on March 20th on how individual workers are supposed to handle their in-home visits that were still required by the state.
Okay. Jill, you want to read our next question?
Yep, Lori, so we have a question for Karen about substance use. Karen, are you seeing an increased use due to the isolation caused by the pandemic?
If you asked me about a month and a half ago, I would say no, but I would say now, since that time, yes. I think the realization that COVID is really we're not done with it yet, and the social isolation, coupled with disease process with alcohol and drug addiction that's relapsing and remitting. It's part of the disease. So just in the last couple of weeks, I have in my population, which is older adults, 50 and older, seen an increase in referrals that I haven't seen since the beginning of COVID. The issue with that is that my patient population is really, they're the ones that really do not want to come into the clinic because they are fearful of catching something. Their doctors are telling them not to spend time around groups of people. And that's the whole premise of addiction treatment, is the group work, the support, the validation. So then we have telehealth as an option, but it doesn't work for everybody. And not everybody really responds to it the same way. So it's challenging, but yes, I would definitely say there's an increase, and there's beginning to be an increase in relapsing as well.
Karen, can I ask you a point of clarification? Because I know that when you were talking in your presentation about referrals, then a question came up subsequent. Now, when people are referred to your program, are they self-referred? Can a doctor do it? Can a family member do it? Do they have to do it themselves and want it? How does the referral process work?
We can get a referral from a doctor, counselor, another agency, but the patient has to be willing to follow through with that. We like, for the first visit, we like to be face-to-face. We weigh the pros and cons of that. I was just questioned about that with one of my patients who is really medically frail. You have to kind of weigh the pros and cons because you want to establish that rapport. And that's so important to therapeutic counseling. So on most cases, we will see the patient at least one time in the clinic, and then we are switching to telehealth for subsequent contacts. And we have telehealth groups. We're beginning to be allowed to have some groups here on site if they're small, like 6 or less, and we have a lot of protocol that we have to go through. But my people aren't wanting to come into the clinic for that. So that's a huge issue. So they're the ones that are saying, no, I don't feel comfortable with that. I really feel like that's going to put my health at risk.
Thank you. Jill, do you want to read the next question in the Q&A?
Yes, we had a question for Michael that we might want to answer live. It was, Michael, the people in facilities really need interaction with their loved ones or people that care. When are they going to allow at least one person per resident to visit as hospitals are doing? Mental health is so important and employees just don't do it. And employees just don't do it for people. So the question is visits.
Yep, I think all the staff here would 100% agree with you. We knew it was going to be an issue right when the policy came down from national. We've been struggling with, again, the technology of the clash between the technology and the dementia. There's one guy up here who thanks me all the time for inventing FaceTime, and I just wish I did. But he gets to see his wife. We have 3 or 4 devices that we try to get folks on to visit with their family. And then, everybody has their phones that we try to use as well. But back to the actual question, we don't have anything coming from national yet to open the nursing home.
So no in-person visits at the nursing home. What about the hospital part or the rehab part? Are they closed still? The whole facility is basically closed to visitors?
The short answer is yes. The longer answer is there's, believe it or not, an application process. So if you want to visit, or if you're coming in for an outpatient appointment, the clinic has to apply on the behalf of the family or the caregiver. And then a group will review the application and approve it. And basically what it comes down to is the person either has to be cognitively impaired, where they wouldn't be able to retain the information provided by a provider, and they need that other person to be with them. That's the outpatient side. The inpatient side, they are allowing one person at a time to come in for folks that are imminent. And then again, very few like new diagnoses and things like that where someone has to come in for new information.
Okay, thank you.
You're welcome.
Hazel, question for you. What new scams are you seeing as a result of this pandemic?
Well, we're seeing a lot of scams that are related to the stimulus, people trying to steal stimulus money in any way that they can. And some of them are really creative. They go beyond the normal, we can get it for you faster, or we can get it for you better, or we can get you more. So we're starting now to see things come out like from fake auto dealers saying that we have your auto stimulus check for you, and you'll get this check from us if you buy a new car, but it has to all be done online, or we can transfer your money from the card into your bank account for you and make sure that that happens in a way that you get extra money. So we're seeing a lot of those kinds of scams. We also see a lot of scams that have to do with a loved one. It's we used to call it the granny scam, and it's been around forever, where you call and say a loved one is in trouble and needs your help. But the kind of pandemic piece of that is saying that your loved one is sick and that they cannot get a ventilator or medication or treatment if you don't pay for it up front. And so we're seeing that as being really, really crucial for a lot of people, because they might say, let them sit in jail if they caused a DUI accident, but they're not going to say, let them go without medical care. So we are seeing a lot more of those. And then just some of the regular scams that we normally see, we're just seeing them increase tremendously, like romance scams and that sort of thing. So I think that there's always, scammers will take any opportunity to prey on people. And they put a lot of effort into sniffing out their prey and making sure they're getting the most vulnerable people, and they will. We had one the other day where someone said, our state regulation is that only 50 people can attend a funeral. We've opened up a lot sooner than a lot of the East Coast has. And so we had somebody who was doing a funeral for a family member, and they received a call from a scammer saying, we can get around that and you can have 100 people. You just have to pay this price for it. So they'll just take advantage of anything.
Yeah,
we are seeing a lot of that.
Thank you. I hadn't heard that one about the funeral. So thank you for sharing that. That's good to
I
hear that.
know. I know. Honestly, if there's anything that has to do with the pandemic, the scammers will find a way to do it. We even have them setting up on corners outside of grocery stores selling face masks. And you would think that that couldn't possibly be a scam because you pay your $2 and you get a face mask, but you're getting used face masks. So it's just, scammers are just scum and they will do anything.
Thank you.
Thank you.
Michael, we had a follow-up to what you just said, and it said, for Michael, can you share what the timetable looks like to approve that application?
I was trying to stop typing and get back to you as quick as I could. So far, the timeframes, once the application gets in, they've been turning them back within 24 hours. So they've been pretty quick. They've been asking the clinic to get, as soon as they make as soon as they're aware that it's going to be needed, and most clinics know who they're going to have to do them for before they make the appointment. But they're saying just put it in right then.
Okay, thank you. Jill, do you have any questions? Yep.
Sure. We have a question for Jenny C. Jenny C., we hear about an increase in domestic violence cases during this time. Are you seeing more cases of elder abuse? Are they more complicated?
So it's a really interesting question. Only because we know that there's been an uptick in domestic violence cases, certainly, but an ability, again, going to lean into what's going on and people being trapped at home with their abusers. So the limited access and limited time frames of having these conversations and really being able to dive in there. And I mean, all of the services that are on here today are really who we lean into as tools and resources to help these individuals. And as everybody can hear, everything's really on pause. So again, we have to just address things with safety. There has been a lot of different referrals coming in for people who are 50 and older. But certainly there's also that mental health piece to a lot of these as well. So I guess it's kind of a give and take because we really can't dive into a lot of it when there's a limited time frame for communication when somebody is trapped at home with their abusers. But there certainly has been an increase in calls more as of lately. Perhaps it's due to things starting to open up and people being able to maybe mobilize a little bit better, remove themselves from situations where they're able to reach out. But certainly I think that we are all bracing for the surge to happen and that we know it's certainly coming because of that increase in domestic violence cases, especially throughout Onondaga County. So we are waiting for that surge, but and it's slowly starting to happen. So I hope that answers the question.
I have another one for you, Jenny C. So are you finding that the clients that you work with are embracing technology? And if so, which technology is becoming their favorite or most user-friendly for them?
So it's going to be a yes and no answer. So yes, I think that we are learning to overcome the hurdle. Initially, when the support group went to a Zoom platform, because Zoom, as it's been mentioned a few times today, seems to be the most user-friendly. It was a little bit of a hurdle to encourage people to sign up for Zoom just by putting in their their email addresses and the concern of, well, am I going to be bombarded with emails and I don't want that. And how does my camera work? So it took a lot of phone conversations to really walk through, I'm going to do this on my screen at the same time, and hopefully we're going to be able to connect and see each other at the end of it. So taking the opportunity to be one-on-one was huge and so intricative in order to make this platform work. But slowly but surely it has. And actually this morning was one of our support groups, and here in Syracuse, the weather is kind of iffy. I think most of everybody here is in Syracuse, so you're all aware. And so we have been going to parks, wearing our masks, keeping 6 feet of distance, which everybody's been really excited about because they were self-advocating to start doing this. But due to the weather today and not being sure if it was going to start raining on us, actually, again, the group members have said, you know, let's hop back on Zoom today. And so the fact that the members have self-identified that they were ready to just, you know, they wanted to use the technology, that was huge. So yes, I think that there are some people that are embracing it. There were certainly a few outliers who were just not willing to jump on there. But phone conversations are huge anyways, and that is obviously a technological piece that people can utilize. But yeah, so Zoom would be our #1 technology that's been used. If you're willing to help people by doing those one-on-one phone conversations and walking them through step-by-step how to do it until suddenly you guys can see each other's faces, it has been really a wonderful tool to utilize, but otherwise just those phone calls.
We have 2 questions for Stacy. Stacy, isolation impacts not only our clients, but it impacts us. Do you have any helpful tips for service providers during this time? And also, what is your opinion of acupuncture as a form of self-care?
So, all right, I'll take the first question first. Yeah, it's really important to engage in self-care, to take care of yourselves, because your job's got harder with the pandemic. It got much harder. And, you know, there are a lot of ways that you can do that. The main thing I would say is pick things that are easy for you to start. Breathing exercises are probably the easiest thing to do for self-care. There's one you can look up online. It's the 4-7-8 breath style. Trying to eat more healthy, which is hard because we're all home. The COVID-19 is assuming, for me at least, is like, oh, we can gain those 19 pounds, you know. But to try to really, you know, to engage in activities that make you feel connected. It's harder to connect with others by Zoom than in person. If you work in an organization where it's possible, I would encourage you to maybe form a group with your coworkers. And it could be, and I've talked to a number of different agencies over the years, and these are things that folks have done live. So there are different places where people in the organization formed, someone mentioned the book club as a cover, but they formed a real book club. So it gave them something to think about and talk about that wasn't the work, but they could still connect to one another. Club type thing works well on Zoom if you're at a place where you can get a group of people together. Being there to debrief for one another is always helpful. You know, any way that works for your organization, and there are many, but different organizations have different personalities, that allows you face-to-face time or phone time where you're actually interacting with another person, even if it's not in person. It is an important part of self-care. And, you know, doing things that aren't necessarily about the work all the time, you know, finding a way to laugh together or have a virtual cup of coffee together. It's hard and you have to be creative, but I think not losing that connection to other workers and the support that you got from them is really important. The second question was about acupuncture. Acupuncture is great when done by a trained certified professional. So I wanted to just be clear, if we're talking about acupuncture as self-care, I'm not supportive of people going on the internet, getting some needles and trying to figure it out for themselves. I don't think that's a really good idea. I think it is a good idea to find someone who's a professional, and for certain conditions, for pain, for nausea, for anxiety, acupuncture is for addiction. There are studies that support acupuncture being really helpful. Again, the main thing is to find somebody who's certified, who comes from an accredited school, and who knows what they're doing.
Great, thank you.
We have a question for Cindy.
Okay.
Cindy, are you able to connect with older adults through your program who do not have access to technology? Are there programs that use a telephone?
So we do have the National Oasis actually launched a program called Conversations That Count, which is a weekly kind of scripted program where a group of about 10 to 12 people get together on a phone. They use a conference line and they get together and kind of talk about different things about what, what is isolation like for you, to how do you create your family tree, all kinds of topics. I think there's over 50 topics that they can discuss in a fairly scripted way that allows people to connect, sometimes, related to the isolation piece, but sometimes just to connect about life skills kinds of things where they can realize they're not alone. And it's, for some people, it's that one kind of weekly call that's really meaningful and they look forward to. So, and then I think kind of the neat thing is it's, the National Oasis office is in St. Louis. So there's folks in St. Louis that could potentially connect with folks in Syracuse, and you might be able to share, some of the differences and some of the similarities of the situation.
Cynthia, when you switched to a virtual format for many of your programs, did you, once people got used to it, did you see an increase then in participation or a decrease, or has it remained level? What's the trend you're seeing with people using that technology,
I think
that platform?
There's a couple of things that come into play, because here at our site, we have the ability to use 5 different rooms at any one time, and then we have the ability to use off-site locations. Now we have essentially 6 Zoom licenses that get locked up, with classes. So that's in some ways limiting, in some ways it's not. But having people using all those licenses and then having to have staff on each of those calls to manage them, it's been a monumental lift to get those going. I would say there's a very loyal core group of Oasis participants who have continued on in taking the Zoom classes, and there's some that really, really, all of them miss the interpersonal connection, but I think they really miss just seeing people. And I have a few people that were loyal participants who just don't want any part of the virtual connection. So it just kind of depends. I think in a lot of ways, there's some folks that have loved this because they can do their fitness classes, for example, and they never have to leave their home. It'll be a great filler for us when the weather gets bad. We can still have classes. Or if we run out of space, it's a great way for us to expand classes once we're back to in-person classes, because we can still say, oh, no room, we can do it online. So there's definitely pros and cons to this.
Here's a question that anyone can answer, because this is very open-ended. So if anyone wants to jump in, what is a service your agency provides that people would be surprised to hear that you offer?
I can jump in on this because I can tell you that we are looking at the potential for doing some virtual tutoring. So we have some tutors that want to volunteer, and we have one district that's interested in piloting this to see if we can actually do it, because we're not sure yet whether they're going to be doing in-person classes yet in the fall, and there's still going to be kids who need help with their literacy skills, and they're only going to get left further behind if we can't do something to help them with those things. So that's one thing I'm pretty sure people wouldn't know that we do. So that's kind of exciting. I don't know how it's going to work out.
Yeah, that's great. Thanks for sharing. Anybody else want to share something that they do that people wouldn't think about their agency doing?
I can't think about something specific, but I can say when we do our public hearings or we do a lot of outreach, people will say to us, I didn't know you did that. I had no idea you provided that many services. So it depends on what the person needs. They may need assistant-escorted transportation. They may need health promotion programs. That Cynthia was just talking about. They may need, I know everybody knows about Meals on Wheels. Everybody knows about congregate dining and in-home care, but our respite support groups, our caregiver support groups, a lot of people don't know that. So I think it just depends on the individual, but we do get that a lot, Lori, when we go out and do presentations. I didn't know you did that. So it's a good thing that we get out there and do. And that's one of the things we miss the most, is going out and outreach. So that was a good question.
Thank you for that. Yeah.
So I wanted to add something to that too. I think one of the things that surprises people is something that both Lori and I participate in, which is, I think that when people hear Colorado Bureau of Investigation, they think we only work with Colorado. But there is a national organization of collaborative groups, all of whom work with victims of identity theft, frauds, scams, that sort of thing. So when people call one of us, we can connect them to people in other states, in their state, who might be providing that service too. Because we are all connected to one another, we talk to one another all the time, and we work collaboratively together. So I think we do have a 24-hour hotline, and I think it always surprises people when they call us from another state that we'll say, oh, the person you need to speak with in your state is so-and-so. There is an organization there. And so I think it surprises people to hear that you can call a hotline in Colorado and get a service in New York.
Yeah, thank you. Thanks for sharing that. Jill, do you have anything else?
Here's one for possibly Karen, Jenny C, or Michael. We've learned that social isolation in older adults can lead to increased depression and anxiety. Have any of you experienced evidence of increased suicidal thoughts or actions in the people you are working with?
So I'll jump in here and say, unfortunately, yes. There has definitely been the need to field a lot of these concerns with people who are identifying as being more anxious, being depressed, being afraid to go get things such as like their groceries, and just going out and doing things that are opened now, but feeling this panicked, feeling like they're just still not necessarily comfortable, because as I'm sure everybody feels, the answers that we are receiving aren't necessarily straightforward. And we know that a lot of these activities are still a risk. So I definitely think it has impacted the feelings of perhaps suicide, but definitely depression and anxiety. And anytime that we get a call where we are concerned that somebody is suicidal, we are definitely asking them whether or not there is a plan, whether there is a timeline, and assessing whether or not we need to call 911 to send a wellness check to these individuals, as it's our responsibility in talking to them to make sure that we can keep them safe and that they get the proper resources that are needed in those times of crisis.
I would agree with Johnny. We assess suicidality in all of our initial assessments with our patients. Definitely an increase in depression, and I would say an emphasis on an increase in anxiety about the future. And we talk about that a lot in addiction, and we do a lot of work in that topic. But at this point, this what's happening with COVID goes above what seems to be reasonable when you're dealing with someone's addiction treatment. It's over and above what the usual client is used to dealing with, about the fear of the unknown, fear of the future.
Thanks for that. Okay, one more for Hazel. We want to try to find ways to combat social isolation, but we also need to be mindful of how scammers groom their victims. Are there any tips you can give to service providers and other community workers reaching out by phone to older adults? In other words, how can we best gain the trust of the older adults we're trying to serve, but also protect them from bad actors?
I think that is a great question. And we deal with that all of the time. We call someone on the phone and say, we're a law enforcement agency calling you. But we've already put out the message, don't trust people calling you saying they're from a law enforcement agency because they're scammers. So one of the things that we have set up is that we will call them and identify ourselves and say that we'd like to speak with them. And then we encourage them to call our agency back with a phone number that they can get from the internet or from information or from their local police department and ask for us specifically. So that way they know that they've initiated that call and that they're calling the real agency. And then they're a little bit more likely to believe us and to trust us. It also helps that being essential workers and first responders, we can actually send someone to the door with a badge who can prove. But I'm so proud of the people that we work with when they tell us to wait on the front porch while they check their badge number and make a phone call and make sure we're legit. Because we do have a lot of fake police officers out there. So we know our message is getting out there, and I think that's positive. It does create a little bit of a challenge for us, even when we're going in person. Even when there's a black and white in front of the house and a uniformed officer standing at the door, we still have to prove who we are. And I think that's a sign that we've done our job and we've done it well. But really having them call us back and verify that we're who we say we are. When we call people, my phone number doesn't show up on their caller ID. It's a hidden number that shows up. So I make sure that I unblock that service before I make phone calls so that they can see the phone number they expect to see on the caller ID. And so I think that offering them those little reassurances, our badge numbers, the ability to call and verify that we are who we say we are, is one of the best ways that we can help protect people. And we also tell people don't click on links. And that's a big thing. Don't click on a link in an email. Don't click on a link in a text message. And then we send them an email with 15 links in it. So we've tried to get much better at not doing that and saying, if you would like to, here's a link, but here's how you can find it on your own. And just making sure that we can give people instructions to do that so that they can do what we tell them to and not click on links. And then we try not to be participating in the kind of behavior that they expect from scammers. And I don't know if that answers the question fully or not.
That was great. That was great. Thank you. Here's another one that anyone can answer. How are you preparing for the opening up? Because, here in New York State, we're now on phase 4. So how are you preparing for the opening up and potential increase in needed services? So Jenny C. alluded earlier to kind of a surge of services. So how are your agencies preparing for that? Anyone want to jump in?
Well, I can talk about the Department of Adult and Long-Term Care. We have been preparing since the beginning of how we are going to meet an increased demand. We know that there's going to be, we already have an extensive wait list for our in-home services program. We have more people registered for our senior shopper service because of COVID than ever before. And we know that that's going to increase, and we know that there's going to be an increase in people wanting Meals on Wheels. So a lot of our core services and our caregiver services, a lot of our core services, we know there's going to be increases. Luckily, due to the CARES Act, all of the offices for aging throughout the country and the federal level have received some additional funding for COVID-specific activities. So, at least temporarily, some of the funding will be there. But as people start to resume their lives again, or they're making their connections again, we know that we're going to get an increase in calls. We know there's going to be an increase in our calls for New York Connect services. So we're preparing every day by looking at our funding streams, looking at that kind of drives it, looking at the data that we've gathered over the past 4 months, and to see how we can make the expansions of our program more data-driven and specific to certain areas in need. So we're looking at that right now. Luckily, the pandemic has given us, one thing about it, it's giving us the opportunity to relook at, take a fresh look at how we deliver services and how we can expand them even further. So we are working on it, and not just on Onondaga County, but we're working with New York State Office for Aging on the initiative. So along with all of the other counties.
Great, thank you. Anyone else want to comment?
I think from a direct service position, transparency is huge. And, making sure that we are leaning into our community partners and having conversations and keeping ourselves abreast on how they are handling opening. Because when I get phone calls and I need a community partner, I have to be aware of where they are at. So definitely the communication piece is key. And as we all are kind of just bracing for whatever's on the other side of this, Making sure that we're all staying in direct communication is definitely going to alleviate some of that stress. But then being transparent with the people that we're serving, that everything is new and we're taking things day by day, and that we are going to give them the most current information that we have. Because when you're being transparent with somebody, you don't really leave room for these false expectations that can develop, because I think that we have a lot of clients who are hoping that as things are opening up, it's going to immediately go back to the way that things were. And we know that that's simply not true. So the more transparent that we can be, and the more that we are staying in connection with each other, the better we are going to be able to serve people.
Great, thanks for that. Jill, do you have anything else? Any other questions?
Just a quick question for Jordan. Jordan, given the difficulties moving forward with the criminal process, do you feel that perpetrators are aware of this? And if so, have you noticed any changes in their behavior, for instance, not complying with orders of protection?
That's a good question. Honestly, I mean, defendants and perpetrators, I don't know that anything like that really affects their behavior. I don't think it's generally very rational, and I don't think that on the whole they tend to be that smart. But this kind of goes, everything that's been happening in the grand scheme cuts both ways now if you're committing crimes, because on one hand, you might have a judge that's less likely to hold you in custody, or you might have, police officers that are extremely stressed and backed up with more urgent matters. So if you do something less pressing, maybe you won't get in as much trouble. But on the other hand, right now, we don't have grand juries, which means if you commit a serious offense and you get held in and you don't make bail, you're sitting there for quite a long time. So, there are negatives to them too. So if someone is, keeping up on what's actually happening in the criminal justice system and the pros and cons for defendants, there's just as many cons right now, because they need to wait. And all of their rights, speedy trial rights, things like that, they're not ticking right now. So as much as I can't act, the time also isn't counting against me. So I don't know if that's a helpful answer, but.
No, it's great. Okay, so we just have a couple of minutes left. So here's how I'd like to close. I would like to just close with asking each of you for one takeaway from this COVID-19 pandemic in the experiences you're having. So we'll go in reverse order of how I introduced people. And so Joanne, one takeaway for you, one thing you've learned from this pandemic.
I think that we can rely on our community and the partners that we had in our pandemic response. It's not over yet. So, I know we've heard the word collaboration a lot, and sometimes we use it just to use it. But in this case, people really came through for us. And I'm very grateful for the people who called and reached out to us also for assistance. And the thing that I miss, if that's a question, is people wearing a face mask, which I fully support. You can't see them smile. Yeah. So I'm waiting for the time when we can see people smile again. But my takeaway is I'm very grateful to the community and the people we serve. Thank you.
Thanks, Joanne. How about you, Morgan? One takeaway. You have to
Yep, I did. Mine, I guess, change is really the only constant that I'm seeing. It's just after 25 years of doing this that then you come to this and see everything kind of dumped on its head and see changes that had no ability to anticipate.
Yeah, thank you. Jordan?
I guess what I would take away is how innovative we can be. While things are by no means perfect, and we all talked about all the challenges that we face day to day, I think that as a community, we've done a great job of figuring out more creative ways to do things. For example, this conference, instead of, just giving up and saying, well, we can't have a conference this year, Lori's done a wonderful job organizing it so that we can still, get to collaborate with each other and share information. So I think that we've done a pretty good job of being innovative and making the best out of what we have right now.
Thank you. Michael, one takeaway for you.
I am continually surprised on how successful the VA has been on getting all the employees and medical providers to do telehealth and what the VA calls VVC, the virtual video conferencing. So all the doctor's appointments that we've had and all the employees home and working remotely.
Thank you. Karen, a takeaway for you.
Probably the one good thing about COVID-19, because there isn't really much good about it, but the one good thing is it's shined a light on social isolation as a problem in our society, especially among older adults. Now that everybody's experiencing some degree of social isolation, it's really on our radar more. So hopefully we're all going to work really hard to figure out what can be done about this and continue to be creative, like Jordan says, and not just throw your hands up and say, nope, it can't be done, to find ways to reach people so everyone can stay more connected.
Great, thank you. Stacy, a takeaway for you.
I think the takeaway for me is how incredibly important maintaining connections to other people are, and how hard that can be, but it's worth the work of doing it, because that connectivity, I think, is what allows us to get through this in better shape.
Thank you. Cynthia, one takeaway for you.
I think flexibility is imperative in creating programming, and I think the ability to pivot on a dime and make changes where you need to so you can continue to reach people is something that we've refined through this pandemic, and I think it gives us hope that we can continue to expand and reach out and make meaningful connections.
Thank you. Jenny C., one takeaway for you.
All right. Well, I think one of the biggest takeaway for me is just how impressed I am with our community and how everybody has really, come together to collaborate and to make sure that we are best addressing some of these gaps where they exist, when they exist, and just being there to support each other in the work. And I couldn't be prouder to be part of this community and to be learning from everybody, including all the people that are not just on the panel, but all the people that are listening, because I know that there's a lot of people throughout the community that are just really leaning into each other. And when we do that, we're able to do the work as best we possibly can.
Great, thanks. Jenny Ackley, one takeaway for you.
I think one more thing that this pandemic has done is it's really highlighted the inequalities that exist, both with Black and Brown communities who were more highly impacted by COVID itself, but in total with how the justice system has been difficult and resources have been inadequate. So I think it has really elevated issues that have always been there so that people can see them more clearly, and I am hopeful that means change going forward, that we're going to be moving in a direction to start dealing with these.
Thank you. And Hazel, one takeaway for you.
Okay, well, first of all, thank you, Brianna and Tessa. You guys have been doing a great job, or you ladies have been doing a great job. So I guess my big takeaway is that as corny as they are, platitudes can often be true. And we have discovered that we really truly are all in this together, and that patience is a virtue, and that it's always good to be able to go with the flow.
Thanks. So I want to share one last comment that was just left in the Q&A. If I can, where did it go? It says, kudos to Vera House on hosting this conference virtually. Thank you to all the presenters. So I want to echo that by thanking all of our speakers throughout this virtual conference. We've had 9 sessions, so it's been a great experience, and I am truly grateful for everyone who has collaborated and come together to help make this happen. I want to thank our 2 amazing sign language interpreters, Brianna, hi, and Tessa, who have been with us through this whole process as well, so thank you. Jill, thank you today for coming on and helping me monitor the Q&A feature. And just to all of our participants, very much appreciate you jumping on board with this new format and being part of this. So with that, I will say goodbye and wrap up the 2020 virtual Elder Abuse Conference. So thanks all. Have a great rest of your day and goodbye.
Bye.
Bye.
Bye. Thank you, Lori.
Bye.
Thank you.